We're good to go.
Okay, is everybody? I think we've still got one connecting to audio. There we go. Okay, hi everyone. Good afternoon. Thank you so much for coming along to this little session on the Masters of Public Health online and all the other little bits that we do within that. What I'll do is very quickly share some slides. Sharing's not turned on, and I'll
Can you share your presentation? I'll give you the rights if you click on share.
okay. Request sent. Okay, perfect. Okay, so hopefully everyone can see that okay. I am using a dual screen. Has that went a bit bizarre or is it looking okay?
It's looking good.
It looks okay. Perfect. Okay, so welcome to Public Health Online. My name is Dr. Hayley Connell and I am the Programme Director for the online section of Masters of Public Health. And I'm just going to go through sort of some of the kind of key details that you all might be interested in, and then feel free to ask questions at the end.
If you can put it on slide display, I think it'll be bigger.
I think it's because it's dual screen. Just give me one wee second. I
Okay.
will stop the dual screen. Okay. There we go.
Yep. Good.
Okay, so some information that might be interesting to some of you, just a little bit of a background on public health. So technically the definition of public health is it's the science and the art of protecting and improving the health of people and their communities. And within our programme, we make a big, massive effort to make sure that we have a global view on public health. So it's not necessarily just public health that's going on within the UK where we're based. We want to have a look at all corners of the planet. A Masters of Public Health online from the University of Glasgow will absolutely allow you to develop all the skills and knowledge that you need to make a difference if public health is something that you're interested in, or if you are already in public health and you're wanting to sort of move through the ranks a little bit, we will give you sort of lots of information and key skills and graduate attributes that will be helpful to you. The fantastic part about the online program is that it gives you the opportunity to learn at your own pace. So a lot of our current students work full-time jobs during the day and then they will engage with their studies at times that suit them. Online learning again is fantastic because it means that you can be a part of the University of Glasgow and experience the outstanding education that we offer, and you don't have to relocate. So you can be anywhere in the world and you can get a master's from our university, which is quite fantastic. And one thing that we do pride ourselves on is that we have a very supportive learning environment and the staff are always here to help. So why might you pick our programme? And there's lots of different individual reasons that you'll all have, but some things that I thought were quite key, I've sort of summarised here. So firstly, you're going to be taught by world-leading academics. So our courses are all led by sort of research and teaching staff. They all do research in their own rights and they're all experts in their field. And those are the people that will be teaching you and developing your course content. We're very multidisciplinary. Staff come from a huge number of backgrounds and bring expertise in all sorts of areas, which is fantastic when it comes to dissertations. So we get students that come up with lots of different colourful ideas of what they would like to do, and we can almost always find someone that has a background in that. So it's really advantageous for our students to have that support. The university itself is classed as world leading in terms of its research. So you can be sure that the research that you're being taught and that your content is based on is absolutely excellent. We are constantly doing improvements and updates to the courses, and we're also developing new courses all the time. We make sure that the way we teach you is evidence-based. So we don't have any courses that have sort of been sitting on the shelf for lots of years and haven't been looked at. We look at them every year. We look at student feedback and we make sure that everything is novel and up to date. For our core courses, we use interactive online teaching platforms. Our teaching is asynchronous, which means that you are able to do it in your own time and you don't have to be live at the same time as the teacher. But we do sort of give lots of active learning opportunities and things. So there's sort of busy discussion boards that are involved so that you still feel like you're getting that student experience. One thing that may be important to you is that we are a Russell Group university. We are classed as one of the 24 world-class research-intensive universities. And it is important to some people that they get their degree from a Russell Group university. We have a huge focus on our graduate attributes. So we don't teach you for the sake of it. We have a think about what it is that you need in your careers and what skills you might need. And we try and base assessments and we base sort of any activities we give you on that to make sure that you're well equipped for the working world. We align closely to our on-campus sister to ensure that your learning experience is the same. So we have a very vibrant on-campus course with lots and lots of students on it, but your education and your course content is mirrored with theirs, so you're getting the exact same. There's always opportunities for engagement. Staff are always happy to meet students. We put lots of things on for you, whether it's academic or whether it's more about sharing recipes, sharing sort of things that you're interested in. We want you to have that student experience, and we try and match you up as well with the on-campus course, so you're not sort of segregated. So what are our programme options? So we do the full Masters of Public Health, and we also do a diploma, and we also do a postgraduate certificate, and I'll go through each of those in a second so you know what the difference is. The great thing about it is you can start off with a postgraduate certificate if you want to, and you can convert to a diploma. If you do the diploma and you think I want to do the full Masters, that's absolutely fine. We will carry your credits across, and that does happen quite commonly. So first off, the Masters of Public Health. So it is made up of 3 core courses that you absolutely must do, 3 optional courses, so you get to choose what you're interested in, and then a supervised 60 credit self-directed research project, and that totals up your 180 credits. The Masters of Public Health online is done on a part-time basis. The average duration is about 3 years, and our timetable is sort of based on a 3-year period. But you can take up to 6 years, and the fastest we will allow you to do it is 2.5 years. And that's just to sort of protect the sort of the load that this course can put on you if you try and do it too quickly. So the postgraduate diploma, what you would do for that is you would do the same 3 core courses and you would choose 3 optional courses from the same catalogue. And that would total you 120 credits in total. It takes 24 months to do. And basically the difference there is that you don't do your dissertation. So you can see why that is very transferable. You could do all of those courses and think, actually, I do feel like I could do a dissertation, and you could transfer to the Masters. The certificate is slightly different. So you will do 2 core courses, and those are Introduction to Epidemiology and Statistics and our Principles of Public Health. So you must do those 2, and then 1 additional 20 credit course that you're interested in. It takes a year to do it, and it's 60 credits in total. So our core courses. So we do have a sort of a summary of each of these courses on the website that you can look in much more detail. But basically, if you were to choose to do this course, you would be asked to complete Introduction to Epidemiology and Statistics. You would be given Principles of Public Health, which is an overview of all things that we think are key within public health. And you would also be given quite an intensive course on research methods to make sure you're equipped for research methods in the working world, but also to make sure that you are able to do your dissertation as well. These 20 credit courses are all 10 weeks in length. We have an array of optional courses. Some of them here, these are the popular ones I've popped up. So things like advanced epidemiology. If you're less interested in that and you're more interested in things like health promotion or health economics, we have options for those. As I've said, we always look to develop new courses. So at this moment in time, advanced statistics is being put together, and that will be ready for the next academic run. And we also have a course called Geographies of Health and Health Inequalities, and that has just been developed and put together. So it is novel and brand new, and that one is ready to go for the new academic year as well. We do have an on-campus planetary health option, and we're in early discussions to transfer that over to online as an option as well. So we're constantly thinking about new courses that might be interesting, and we take on student feedback as well. So what a typical structure might be if you were to do this course. So if a student was to start in September, you would start off with your principles of public health to give you a real sort of idea of all the different things that public health encapsulates. You would then move into semester 2, which starts in January, and you would do your introduction to epidemiology and statistics. And already you've done two of your 3 core courses. In semester 3, which is April, we would ask you to pick a semester 3 optional course, so it would be something like health promotion or geographies of health. The following September, you would come back and you would complete your final research methods core course, and that would then mean you have all the sort of skills that you need in order to do your dissertation. You've got your research methods and you've got your epidemiology and statistics analysis skills as well. You would then pick a semester 2 course. We have a huge amount of options for semester 2, things like advanced epidemiology, advanced stats will go into that course as well. We've got qualitative research methods for people who are more interested in that. Globalization is a hugely popular course as well. And then in semester 3, you would pick another semester 3 option that you haven't done already. And then the third year is completely devoted to your research project. You will be assigned a supervisor, and you can do either a student-led project. So if you have an idea that you want to do, we will fully support you in that, as long as it's reasonable within the year. We also have lots of supervisor-led projects that are advertised if you would like to sort of learn from one of our leading researchers and jump into one of the research projects they already have going. So there's a couple of different options there, but you're very, very well supported, and you get so many transferable skills out of doing that. So we have lots of different sort of teaching methods and sort of ways that we try and do things to make it as vibrant as we possibly can, because obviously you are online and it is an asynchronous learning environment, which means that you do not have to be on at the same time as the teaching staff. So that means that live sessions are not the normal, and what happens is you go on and you will engage with the content in your own time and complete the tasks that have been set for you. You will work in small groups for some of the courses, and it is a little bit different depending on the course. They all have small group discussions. We use things like Teams, we use Moodle platforms, so that you can all chat to each other, and the course lead will also chat to you. And if there's tasks being sent, they will give you feedback and things. Some of them have tutorials and seminars, not all of them. Things like statistics will do sort of ad hoc tutorials because of the type of learning that's involved in that. But principles of public health, for example, is mainly asynchronous. But at any point you can have a one-on-one sort of discussion with the course lead, and all of the staff are very happy to do that. You'll do things like student presentations, there's virtual learning environment activities that you'll pop into, so there's videos, there's animations. We've got lots and lots of videos from sort of key people in the area that don't necessarily work at Glasgow University, but are affiliated with us in some way. And they talk about what they're doing in their research. And all courses have their own Moodle site with all learning content available in the one place to make it nice and user-friendly. So in terms of sort of learning outcomes, so what we would hope that you would be able to do at the end of this, and this is that's mainly for the masters, is that you would be able to critically evaluate sort of key theories and concepts, to analyse and engage with fundamental aspects of public health, and we look at things like health policy. You'll be able to do your statistical analysis and your epidemiology. We have a huge focus on determinants of health and how they influence absolutely everything within public health, and you'll see that sort of thread through all of the courses. You will be able to synthesize and effectively communicate sort of information that you generate yourself or information you find. And critical appraisal is a tool that we will teach you as well. And finally, you will be able to design, develop, and execute a research project, which is a fantastic skill to have if you're going on to further research or intervention development or into sort of public health areas. Entry requirements that we will accept. So we will accept a 2-1 in a relevant degree or a 2-2 with some work experience. So a relevant degree is realistically anything within sort of the science or health component. We do have very specific things put on the website, but actually what we will accept is anything within the sort of science area. Applications that are borderline, so a 2-2 or a third class, will be sent to myself to review. As long as you've got a little bit of sort of public health background and you can demonstrate that, then most people will be accepted. If you do have any questions about your suitability, then there's an email address there if you ask questions, and basically that comes straight to me and our admin team, and we will be able to see whether or not you're likely to be accepted. Career opportunities from some of our public health students that have went on to do different things. They filtered back to us that they've went on to do research, specific health promotion specialists. We've got epidemiologists, health information managers, data scientists. We've also got a lot of community health workers. We have people that will go into health education, and there are further study opportunities as well. Obviously, if you get a master's, that opens the door for PhD, and we do have PhD programs within the school as well. So for any sort of further information, you can visit the university website, and that will give you sort of understanding on how you apply, what the fees are, how we sort of get our applications. Basically for online, we will accept applications right up until programs start. So it's quite flexible. And again, we've got that sort of very specific public health mailbox that you can direct questions to, and you'll be answered for that. So hopefully that gave you a bit of an overview of the programme, and I'm happy to take any questions. So thank you so much, everyone. No questions. So as I say, if anyone does have any questions and they would like to perhaps not share at this point in time, then please feel free to send your questions over to that mailbox, and they will be answered either by our fantastic admin, Margaret Ashton. She is an absolute gem, and she will be very well acquainted to any of you who do decide to do the course. And then it will be referred back to myself as well. So we're happy to answer anything at all.
So a lot of the participants on the call would like to know how they can manage working and studying, and how much time they need to allocate every day or during the week for studying an ODM course.
Okay. Yeah, so the fantastic part about online is that you can sort of decide when you want to study, and because of that, it means that our student cohort normally all have full-time jobs. So it's not unusual for that to be the scenario that everyone's in. So it's absolutely doable to be able to work full time and to do your online Masters of Public Health. You do have 6 years, so there isn't any huge pressure to finish very, very quickly. So we have lots of different support mechanisms in place. If you feel that there's a point where your sort of daytime job is really kind of full of pressure, we can sort of pause things. There's lots of different support mechanisms there for you. In terms of time, what we would say is 20 credits equates to 200 hours of study. So for one 20 credit course over a 10-week period, we would imagine for you to sort of get an A grade for it, that you've put 200 hours of work into that very roughly.
Perfect. Thanks so much.
So there
I've
is,
shared a few generic, oh, sorry, go for it.
yeah, so we question here, what is the turnaround time for questions sent to email regarding acceptance suitability? Very quick. So if you send that over to the inbox, it will go to Margaret. Margaret is off tomorrow, but she will be back on Monday and she will ask for any relevant information that we might need, and that will get sent straight over to me and I will answer on that day. So pretty quick turnaround, less than a week. You can send a copy of your transcript and CV as well. That will help me to ensure that I'm giving you the correct information. So that when you do go for full sort of admissions that you know that you're probably going to get accepted. So it's absolutely fine to send those over. You don't have to though. Any more questions? Okay. Perfect. Thank you so much for coming, everyone. And it would be lovely to see you in the future on our online course.
Thank you so much, Haley, for your time, and uh, and to everyone on the call as well. Look
Okay,
forward to hopefully seeing as part of the University of Glasgow soon.
perfect. Okay, thank you so much, everyone. Bye.